Usually I'm on the top of it, like who I need to bring in. So now I'm going to be all flustered.
Sorry.
No, it's okay.
I have a full house today.
Yeah, I see that. Well, let's go ahead and get started then. It's 10. That's after. All right, Gary, what's on the agenda today?
All right, commissioners, this is Tuesday, December 15th, your last issues session of the calendar year. We have quite a number of topics. Not all commissioners are present yet, but I know Commissioner Savas and Schrader are on their way. But we'll start with wildfires update. Nancy Bush, Director of Disaster Management and Incident Commander of our Emergency Operations Center. Please go ahead.
Good morning, everyone, and thank you. So just a little bit of our statewide data. And we see a lot of things kind of settling in, but yet moving around because we're well into our recovery. So the sheltered persons in this state right now by the American Red Cross is 1,023. And we do know that the American Red Cross has 2 of our households that they are sheltering right now, but they're in Multnomah County. And on January 1st, all of that sheltering is going to turn over to the Oregon Department of Human Services, and we will become much more involved in some of those issues. We also have 5 families here in Clackamas County that we're working with social services, and they have been sheltering them as well. And we're going to be trying to work with those families to see if we can get them some other individual assistance. For the state, for individual assistant registrants, there's 25,153. 2,430 of those are here in Clackamas County. And the assistance approved statewide is $30.5 million. And here in Clackamas County, that's 528,749. So just to remind everyone, because we haven't talked about this in a while, but the acres that were burned is 1.2 million, and total residents destroyed in the state is 4,026. And over half of those are in Jackson County, just as a reminder, which is around 2,300. And we had around 61 here in Clackamas County. In addition, we are working with ODOT on the IGA, and we're meeting with them this week to talk about some of the changes that we would like to see to the IGA. I understand they're meeting with the other counties as well. Again, they want us all to sign the same document, which is understandable. So there's going to be a little bit of working around with the other 7 counties as well as ODOT to make that all work. And we are continuing to work with all of our county departments here to collect all of the damages that we have in Clackamas County that is public assistance, so we can get that into the system for FEMA. And we're encouraging the cities and the other special districts to do their own. We don't do that for them. So we're trying to make sure they get the information to know how they can do their own, and making sure that they are taking the FEMA training as well, because we certainly want our special districts as well as the cities to get their public assistance as well. And that is my wildland fire update for today.
Any questions? I don't see any questions.
Okay, I will move on, and all commissioners are present now. Next, a coronavirus update. Nancy, please go ahead.
Yes. All right, going through our numbers for today. So in Oregon, there's 95,010 positives, 1,161 deaths, which is up 116 from this time last week. In negatives, there's 2,171,369. Clackamas County has 12,478 positives, 97 deaths, which is up 10 from this time last week, 231,203 negatives. Multnomah County has 31,633 positives. They have 305 deaths, 528,142 negatives. Washington County has 20,218 positives, 117 deaths, and 337 and 401 negatives. There are 539 statewide hospitalizations, which is actually down 26 from last week. There's 121 of those are in ICU beds, which is only up 1 from last week, and 66 on vents, which is up 3. Here in Region 1, which again is Clackamas County, Columbia County, Washington, Multnomah, Tillamook, and Clatsop, we have 335 ICU beds that are staffed at this time. 265 of those are occupied, which means there's 70 available here in our region. The non-ICU beds that are staffed is 1,900. 1,685 of those are occupied with 215 available. And I do want to show our graph again here today on the hospitals. So you'll see here that we do have a little bit of a downturn. There's a tiny uptick this week, but there is a downturn here for our COVID positive patients that are in the hospital system. Going down here, you'll also see that this continues to rise, even though we do have a slight downturn here as well, which is how many are in the ICU beds. Our vents are going up. You see that the tick continues to go up. So those that are on ventilators is going up slightly. So again, we have quite this spike right here. So we'll see kind of what happens over the next few weeks here. So our total cases for December 7th through the 14th is 127, which is down from a little over 1,000 last week. We're at 195.2 at 100,000 per 100,000 this past week. Our outbreaks, so we're working on 93 outbreaks. And again, just a reminder that we're missing some outbreaks because of how we're having to concentrate our efforts for public health. We have 23 for workplace. There's 9 in food or farm, 44 long-term care facilities or retirement. Daycare is 5, schools are 8, religious facilities 1, healthcare setting 2, and social setting is 1. We do have the 2-week metrics for the schools, which I sent to everyone yesterday evening. So the total case count, and remember our metrics for the extreme, if we're in the extreme or high or whatever category as well, or the schools are the same. And we're looking always at a 2-week measure. So the measures for 11/29 through 12/12, the case count is 1,989, which is 469.8 per 100,000. And our test positivity is at 7.1%, which is actually slightly down from the last 2-week period, which is good news. It's not where it should be, but at least it is down just a little bit, which I believe 2 weeks ago, it was 8.3. Also, just to let everyone know, we did have the Spanish town hall yesterday. I talked to Philip a little bit this morning. He felt that it went well. Really glad that we had that. Our last Sandy flu and COVID clinic is this week and the last one of the year. And it is at the Sandy High School tomorrow from 3 to 6. And also the hospital, some of the hospitals, not all of them, but some of the hospitals here in Oregon do have their vaccine now. And that is my update.
Well, let me just add a little more to that. We had 9 counties that moved. Benton, Clatsop, Coos, Curry, Lincoln, and Tillamook moved to extreme. Grant, Harney moved to low. Lake moved to moderate. So we've had, I think I heard 27 counties are now in extreme. And if you look at the report, actually, our neighboring county, Marion County, is worse than we are. They're really, I remember Paul mentioning it's kind of strange that the governor moved them, put them on phase 2, and we were left at phase with Multnomah, Washington, and Tillamook County, yet they had higher counts, and it's true. Anyway, Martha and then Paul have questions for Nancy, I assume.
Yeah, Nancy, so what's the logistics for rolling out the shots for vaccines? Healthcare workers first and long-term care, but have they got the logistics, and is it the Pfizer vaccine?
Yes, so Pfizer is the only one right now. I heard Moderna, I read in the New York Times this morning that Moderna, they're expecting it to be approved today, I think, by the FDA. But yes, so right now it's just Pfizer. And so everything right now is none of this actually is right now is in the local hands. OHA is actually working with getting the vaccine in and where it is being sent. Okay. But yes, you're right. The priority right now are our healthcare workers and I think our long-term care facilities.
I know we got asked last night about access more than once. And it, like I said, it seems directly out of our hands right now. It's the OHA and,
Yeah, there's none for the general public at this time.
okay, thank you.
And also only 30,000 came to Oregon,
Right.
which is not very much if you
Nothing.
consider you need 2 shots.
Mhm. Right. Yeah, there's 300,000 healthcare workers and we got 30,000.
Paul?
Yeah, a couple things, just real quickly, just a comment or pick up on the listening session town hall we did last evening. You know, it occurred to me in the past, and it occurred to me again last evening that as we hear about access to our services on behalf of challenged communities, that DHS is part of this. And yet it seems to me that we ought to be, we don't know if some of these folks are actually contacting us or they're contacting DHS. I do know that I've heard concerns about how difficult we are or they are. And I'm just really wondering if we continue, hopefully we continue to do these outreach to communities of color, that we not only have the language abilities to communicate, but also maybe see if there's someone or an arm, a local arm of the DHS that can participate and help maybe either offer connections and services. But I think we're kind of working in a vacuum when we have a great opportunity to help field and educate DHS, if nothing else, along with the folks. So I just want to just throw that out there. That's not the reason I raised my hand, but I just wanted to put that out there. Nancy, Thanksgiving was about 3 weeks ago. And we're kind of, I've been waiting, not looking forward to, but waiting for a surge. And it looks like maybe the good news, if there is a good news story here, is maybe all our precautions have maybe paid off. I know it's early to tell yet. I get that, but I'm not seeing the number. I was kind of expecting maybe the numbers to just gradually get worse and worse and worse. And knowing, 1 week or 2 weeks after contact is when symptoms develop and people start getting sick. And we're almost 3 weeks into that. So what do you think?
Well, so just a reminder though, we did have over 1,000 cases last week. So, we did have a slight downturn this week. So I wouldn't say that there's a trend yet of going down. We've had 1 week of going down, but we do have those cases from last week that if they had contacts, for example, their contacts won't be showing up for probably, 2 to 3 weeks as well. And then we do have the the holidays around Christmas and other faith holidays as well as New Year's Eve.
Yeah, I just want to if nothing else out of my message here is that knowing that the stores are reporting low attendance, transit has got very, very low usage. As a matter of fact, the parking facilities for the park and rides are just vacant. So people are taking precautions, so I think that is part in credit to all of us for getting the message out. And I think we need to continue to do that. The other thing that came up last night, Nancy, I thought was a great question from the audience last evening, and that was, how are we going to get the message out to people who of different languages and so forth who cannot really see or understand our messaging per se. And I mentioned the billboards. The state's got these billboards that we did the yellow thing, mask and all that. And I don't know if there's going to be a continuance of that, but I think the key to messaging is to keep your presence there. Don't constantly change it because people will recognize it. And I'm just wondering if there is an opportunity to maybe do those in multiple languages, at least for those speaking Spanish. But it seems to me that we ought to be doing more of that. If that program continues. And it was in the question, I think one of the questions where it came up, I thought it was quite relevant. When or how will we know when the flu shots or the vaccine shots are available, the COVID vaccine shots are available? How are we going to get the word out?
Mhm.
And so I just want to put that out there, that we need to make a deliberate effort to make sure that we are contacting all those with language barriers.
Yeah, Commissioner, you have a really good point there, and we struggle with that as well. We have been doing a lot of translation here in the EOC. All of our Facebook posts, some of the artwork around those. We do have Google Translate for our webpage, which isn't the best, but it still is getting the job done. We have checked it on from time to time to see how it goes. Also for the wildland fires, as far as I know, the first time in this county's history, we had American translator, sign language there for every one of those particular events. So we are also very sensitive to having someone that's doing that American Sign Language translation as well. It is a struggle. It is a struggle. And I know that, one of our groups from the Leadership Academy is also looking at this to see how we can do this better in Clackamas County. There's been times, especially during wildland fire, when we needed some translation very, very fast. We had to go outside of what we do have contracted for, because it couldn't be done fast enough. And one of those, for example, was Russian, and I ended up, we used someone out of California because we knew somebody from Malibu who was able to get that for us. So you have a very good point. It is a struggle, and we continue to make it better, but we still have a ways to go. And when it comes to, you're right, when it comes to the immunization and the vaccine, we have to make sure we get that out through our CBOs in different languages, in different ways, and making sure all of our population have the access that they need.
Yeah. Thank you for that, Nancy. At our second to last Spanish-speaking town hall, another point was made, and it was actually a really good one. Again, kind of a language barrier of sorts, but the gist of the comment was that they felt that the message that was sent, even though it was in Spanish, was not very clear, and it was confusing. And I humorously made the comment that we have that same problem in amongst us English speaking, that sometimes the messages we put out are not clear and they're confusing. So I made that point again, that not only do we and should we strive to make those improvements, but we want to make sure we run it by Spanish speaking or whatever the languages we're trying to convey, that they feel that it makes sense and they've got the language skills to help make sure that the crafting of the words and wordsmithing it in their language, but in a way that they can comprehend it. And I say so again in the context of when it comes time for the vaccine, as this is rolled out, I'm hearing nationally that it's going to be rolled out in a way that is going to be prioritized. And I think people's qualifications and maybe even requirements to prove whether it's their age or whatnot, we don't know. But that question did come up. How are we going to know who and when gets the vaccine and how the priorities will work? So I think we could take that extra effort and figure out how we convey that with those that have language barriers.
Mm-hmm. Absolutely.
That's all I have. Thank you.
Anya?
Nice to see you, Nancy. Every week we get this wonderful opportunity, and I don't know that you're going to be able to answer this question, but I always want to check my news sources to make sure that what I'm reading is true. So I don't recall which news source this was, but I understand that the vaccine does not actually give you a little bit of COVID like some vaccines, but it affects you from getting sick from COVID, but you could actually still have it and spread it, which means that the requirement for needing to wear masks could go quite into the future until we have herd immunity. Is that true?
I don't know. I will be sure. I'm not sure if it's Philip or Dr. Present coming on Thursday, but that will be something I will have them address. I have also read that true, that we would probably still have to, wear face coverings for a little while. But I will have Philip or Dr. President talk about that Thursday.
Okay,
Good
that's my burning question for the day
Okay.
of reading the news. So thank you.
Okay.
So I did get a notice that the governor is going to have a special session perhaps this week to look at 800 million in distribution. Also, there was a great discussion about jails, people in jails and prisons getting the shot before a lot of other people. And I think people should understand that if one of our people housed at the jail gets sick, we pay for it. And so it is smart to protect their health. Otherwise, the county has to pay for it. So it is, and the spread is pretty substantial. 1 in 10, I think I heard this morning, of people in jail have had COVID. So, or are currently infected by COVID. That's a lot. So anyway, Paul.
Yeah, I just want to kind of build on the conversation that Commissioner Fisher and Nancy just had, and that slightly different spin, but quite related. That is that what I heard from some of the interviews of these epidemiologists and doctors around the country on the national news was that even though as we vaccinate, even if we hit 50 or 60% of people taking the vaccine, that mask requirements and all the precautions will likely be in place for a period of time until it's actually recommended not to. So the presumption that if you get the vaccine does not necessarily say you don't need to wear a mask, quite the contrary, that it will be expected that we all will.
All right, I don't see any other questions, Gary.
All right, so I'm going to switch the agenda just a little bit so it flows more smoothly. Nancy, if you'll hold for a minute, and then we'll come back to you. Next, let's do what I think is an easy one: the Metro disposal rate increase letter draft. Cheryl Bell and Eben Polk from Transportation and Development. Commissioners, you authorized sending a letter at your policy session last week. The draft letter was in your packet. We're seeking your approval to send this letter or hear your edits. Eben or Cheryl? I don't see Cheryl yet. Cheryl, go ahead. Whoever would like to start, please.
Yeah, good morning. Thank you, Gary. Commissioners, we're here today to follow up from last week's policy session. We directed staff to write a letter to Metro expressing our appreciation for them delaying the disposal fee increase to July, and then requesting greater engagement in the fee development process. So the draft letter is provided in your packet, and I'm going to pass things off to Eben to kind of explain some of the nuances of the information we're looking for in that further engagement. And then we're both available to answer your questions on the letter or the process.
Good morning, commissioners. Thank you for having us here. Good to see you. So just to recap, Metro has been talking about some significant fee increases to the disposal fee at their transfer stations. And that was potentially going to happen in January, but after listening to local government feedback, they decided to make it effective in July 1, which really aligns much better with our fee review processes. However, this fee increase is noticeably greater than the more kind of, minor bumps in fees that they've been adopting the past several years. And so we felt it was appropriate for us all at local government to understand more about those fee increases. Now, they are scheduled, Metro Council is scheduled to vote in just 2 days to approve the fee increases, but they wouldn't be effective until July 1. And the fee increases include a 38% increase in the regional system fee and a 13% increase in the tip fee. Note that there's a minor error in the calculation in the draft letter you have, which says 36% for the regional system fee. So staff will correct that to 38%. So this letter essentially does an appreciation for the schedule change, at least with the effective date, and then asks for more information about the changes.
Move to approve, Mr. Chairman.
Second, and Paul.
Yeah, I had my hand up. So Evan, what research or analytics have we done with regards to the proposal that they had? It seems like this was spotted by another jurisdiction, and maybe it wasn't brought to our attention. I didn't learn it until I heard it from a city in another county. And so my concern is, number one, is that were they right? And what else can we glean from that? It seems like, so my question is, how much of that work do we do inside when we get proposals past and present to make sure that we are doing our job? Because we do franchise, obviously these services that affect our constituents. And I think that there's a presumption that we are doing and looking out and checking the math and doing what we can on behalf of our constituents, right? So, the fact that, we didn't spot it, someone else did. I appreciate the letter, but I want to build on this conversation a little bit. So the other thing that's come up, and it's related sort of, and it's a concern that I have, is that when Metro engaged us about the Oregon City Station, or the site, what do they call it?
Metro South Transfer Station.
Yeah, the South Metro site. And we offered up ideas on how to do that more efficiently, maybe even tying into some of the anaerobic digestion facilities we had literally under the railroad tracks and under the freeway. We could have piped it over. I mean, I thought there were some pretty creative things that would have saved money and been more environmentally sound. So along the way, I know that they've been doing some work and on the location, and I sent Gary an email recently about, hey, what's the update? And this was about a month or so ago, and after we saw the letter from the city of Sherwood. And I said, I thought there were some sites, and he sent me the information that he hadn't identified the 3 sites that Metro stated. However, Metro here about 3 weeks ago actually posted on their website one of the sites. And I thought, geez, why weren't we notified of that? And the part that bothers me a little bit about that's awfully close to the Clackamas River. And from an environmental standpoint, I'm just really wondering environmentally why we aren't taking a closer look at that, and why we aren't more engaged with Metro. And then I find out, I find out that, Clackamas County isn't the only county they're looking to do this. It seems like they want to change or modify and, obviously improve a lot of their sites around the region within their boundaries. Well, I mean, that's all said and good if the approaches are sound and they're environmentally sound. But the question is, are they fiscally sound? And the impacts to our region. The cost for everything is going up so significant. I think we have to be extremely cognizant that people are out there struggling, losing their homes, lost their homes, can't afford their rents. And it seems like so much we do, it seems like we just make the assumption. I don't mean you or, my colleagues. I'm just saying in general, government in general just seems that, businesses and people and employees and households they're just there to be taxed, and they just have an endless amounts of money to pay these things. And obviously we're seeing the results when they're on the streets. We're seeing people struggle. So we have a responsibility to do that. And so I just want to make sure we actually are looking at that kind of thing and figuring out what is the best and keeping a close eye on it. We ought to be bird dogging this aggressively on behalf of our constituents. And I don't mean that we ought to be, rude about it. I think we need to be responsible about it. And I think the way the letter that was written by the city of Sherwood was just that. I think their approach was good and sound. And I know we said a lot of nice things in our letter, but you know what? I think we can say a lot more. I think we can say a lot more about the burdens that this is putting on folks that we need to, and maybe some environmental concerns about future sightings and so forth, and that we ought to be looking at the most practical, most cost-effective way, most environmentally sound way of addressing their problem that they've identified. And that's not in the letter.
So Evan, I want to answer one of his question, if you know what it was?
Well, one of the things I heard in there is a theme that, Commissioner, that you said bird dogging. It sounds like at a minimum, staff should be conveying to our counterparts at Metro the interest in getting more information and updates about Metro South as a project, for example, along with the sort of myriad elements of that project that you mentioned, including conversations with Wes, the location that they recently announced they have an option on, and they're entering into a 9-month period of due diligence. And so we can certainly convey that staff to staff, or I suppose if you want to make a change in the letter, we're here for you.
Okay, well, there's a motion on the floor. Any further discussion on the motion?
Well, I just like to go back. I mean, based on what I've just shared, would you suggest any changes to the letter? Or I'm okay with sending a letter. I'm okay with that, but I'm just wondering if the motion maker and those of me the second would make a friendly amendment to have staff just spruce it up a bit without getting into wordsmithing at this point. I mean, in a reasonable, responsible way. I want to send a nice, clean letter, but to convey a couple extra points that the letter missed.
And what are those points?
Number one, the impacts to our constituents. Well, this letter is specifically about the rates, so let's just keep it simple to the rates. Just concerns about future capital expenditures and how that might impact future fees, and that if they could share their analysis of numbers. I don't know. I mean, that's detail, but just something to spruce up that we want to be have a greater role and involvement in the rate setting, because the fact that they just disclose it, and if we could at least apply a similar level of effort that Sherwood did, we wouldn't be talking about this right now.
Ken, you okay with adding a sentence asking them to give us a greater, more information and a greater say in rates or something like that?
Fine.
I'm fine with that. Can you do that, Evan? All right, let's
Yes.
poll us.
Excellent. Okay, Commissioner Fisher?
I'm an aye, and I don't think this needs to come back to us for approval, if that's okay with everyone.
Fine with me.
Commissioner Humbertston?
Aye.
Perfect. Commissioner Savis?
I agree with Commissioner Fisher. That was my suggestion. Just trust staff to write the letter, but please send me a final copy. Thank you.
Commissioner Schrader?
Aye.
And Chair Bernard?
Aye, motion carries. Thank you. Next item, Gary. Thank
All right.
you, Evan and Cheryl.
Yes, thank you, staff. We're going back to the COVID-19 topic. Let's do the ZDO waiver request first. So Jennifer Hughes will come in. There's a request for a zoning and development ordinance waiver under your COVID-19 emergency declaration. You had information in your packet, a memo. It's for the 24-hour fitness in Clackamas. I'm stalling here. Jennifer is almost here, so she can update you, and then you can make a decision. All right, Jennifer, please go ahead.
Good morning. This is the second one of these that you've reviewed since you added a provision to your COVID-19 emergency declaration to authorize the waiver of certain zoning and development ordinance provisions to allow temporary improvements or modifications to commercial, industrial, or institutional uses, basically to help people meet the social distancing guidelines and comply with the governor's executive orders. In this case, it's the 24-hour fitness on Sunnybrook Boulevard. They are wanting to establish an outdoor workout area on one floor of the parking garage because of the limitations on indoor recreational uses. It does require a waiver of a parking standard and a limit on outdoor storage and display in the relevant zone. It's been reviewed by transportation engineering, by our building codes department, and also by public health. And I know that both public health and the building department have had follow-up conversations with the applicant. So staff would recommend approval. I'm happy to answer any questions.
Move to approve.
Second.
It's been moved and seconded to approve. Any further discussion?
Yeah, I was
Christine?
wondering if we can't take this letter or idea maybe and reach out to some of our folks that have been contacting us about concerns of the lockdown that are in that same business line of work, and maybe they can realize that we have and can make accommodations maybe to help them out economically, and just let them know that there is that opportunity. But maybe that's probably a PGA function, not a DTD function. But I think that they got to figure out a way to survive. We got to be able to help them.
Yeah,
And
except they have,
know that this is an opportunity or an avenue they can pursue.
yeah, they can, but however, this has a parking structure that is not many gyms have. So, but yeah. All right, so it's been moved and seconded. Christina, please poll us. We don't hear you.
Sometimes just unmute doesn't work. Commissioner Fisher,
Aye.
Commissioner Humbertston,
Aye.
Commissioner Savas,
I
Commissioner Schrader,
Aye.
and Chair Bernard.
Aye, motion carries. Thank you very much.
Thank you.
Next, Gary.
So
Oh,
we'll have-
Sonia. Wait, Sonia has it right.
Yeah, just real quick, if we are going to reach out to gyms, just know that the cities have their own emergency protocols, and there are a lot of gyms within cities.
Yeah.
I did do some advocacy on behalf of my own gym to loosen up protocols for parking lots and outdoor recreation, which they were able to do under their emergency ordinances very well. So if we do it, let's please send it out to our partners in the city as well. That's all I have to say.
So I can circle back with PGA and probably BCS as well about who we would do outreach to, but definitely we would only be doing it for the unincorporated area because we don't control what happens.
Well, the cities.
So great, that's a great distinction.
Yes, so I'm asking staff who are in the listening area, PGA, BCS, DTD, please work together, send this communication, copy the board when it's done, please. Okay,
Thank
very
you.
good. Next, please bring in Rich Swift and Jill Smith. We have two different topics related to the Econo Lodge on McLaughlin Boulevard and Jennings Lodge. Nancy Bush as well. We're going to start with the first request. It is for a winter shelter in the Econo Lodge. It is an emergency contract approval under your COVID-19 emergency declaration. We need it signed today. So I'm going to ask Nancy to explain that. It was in your packet. It is not related to the second item, which is potential acquisition of the same hotel under Project Turnkey. So I want to make it clear to those listening, there's two separate items here, but it's related to the same hotel. So let's do Nancy's part first, and then we'll transition into the Project Turnkey project. So Nancy, please go ahead.
Thank you, Gary. So yes, you have in your packet, it is a contract with Econo Lodge for 27 rooms. It is for $363,700. The purpose of the contract, and we want to get it signed pretty quickly so we can get people in, is twofold. One of them is partially for warming shelters and helping the houseless in that regard. And then also part of the funding is from FEMA for individuals that are houseless, that are 65 and older, and or with underlying conditions for COVID. So we just need to get that done. And again, it is separate from turnkey. This is a separate contract, and it is for rooms only for that purpose.
Okay, Paul?
Yeah, I'm inclined to support this. I think it's a great idea. I applaud staff for. I do have a question, and the question is, we're not gonna pay $100 a night, even if the room is vacant. Is that just on an as-needed basis and up to $300 and something thousand, or is this literally reserving the entire building and paying the $300 and some odd $1,000?
It's reserving the 27 rooms.
So more specifically, so it is going to be a bill for that fixed amount?
Yes.
Okay, so essentially, anyone who wants to call up Econo Lodge and rent a room from the time we sign this contract for purposes of visiting will not be able to rent a room.
Not those 27. And Commissioner, when I worked with Brenda, and Rich might want to speak to this too, I don't think any of those rooms are going to be empty.
Okay. Well, yeah, okay, then my question is that $100 a room, is that the going rate? I had someone comment here over the weekend that thought that was not necessarily a competitive rate, and thought for the amenities that was a little bit stiff.
So we actually did bids. So this did go through the bidding process. And this is the best rate that we got for that bidding process.
Okay. Move for approval.
Second.
It's been moved and seconded to approve the lease agreement for the Econo Lodge in Oak Grove Janes Lodge. Christina, please poll us.
All right, Commissioner Fisher,
Aye.
Commissioner Humbertston,
Aye.
Commissioner Savis,
Aye.
Commissioner Schrader,
Aye.
and Chair Bernard.
Aye, motion carries. Next item, Gary.
Thank
Okay,
you.
so Nancy, you're welcome to stay if you want, but you also can go. Your part is done. So next is an update on Project Turnkey and potential acquisition of this exact same hotel under the Project Turnkey project. So we have Rich Swift and Jill Smith from Health, Housing, and Human Services and our Housing Authority to update you on that potential acquisition. Go ahead, please.
Thank you, Gary. Morning, Chair and Board. So as Gary discussed, Project Turnkey. So this is our status update for the board regarding where we are with this. This project and its application with the state has moved very rapidly. And essentially where we are now after submission of our application and preliminary approval by the state for this application is the state has requested that we have a property in place to be able to go forward with Project Turnkey. They have a limited amount of money in terms of reservation, $30 million. They're actually at this point in terms of projects over reserved. And so this is really truly forming into a first come, first served process. The state has let us know that if we wish to go forward and be able to use state funding for a purchase of a motel for both congregate sheltering and then long-term sheltering, we need to submit a property now. So related to that, we have a potential purchase and sale agreement to submit to the board later this week, which is purchase of the Econo Lodge motel on 99. And so in the Jennings Lodge area. And so I'll turn it over to Jill and she can give more detail regarding where we are with this at this point. Jill.
Good morning, everyone. Thank you for the opportunity to talk to you about this opportunity. At your direction, I'm sorry, somebody's at my doorbell. At your direction, we applied for the Project Turnkey funding opportunity, and they broke it up into separate phases. Phase one was we filled out an application in response to the grant that was published through the Oregon Community Foundation. We prioritized serving underserved populations that are homeless in Clackamas County in alignment with the grant's request and prioritization. We did not have a property identified at the time. Once we were notified approximately a week and a couple days ago that we made it through phase one based on our grant application, we were contacted by Tom Kemper, who's operating as their consultant. And we reviewed a list of properties and found one or two that would meet the criteria that the state is preferencing for this funding. And those included ADA accessibility, readiness, as in needing very little work or rehab to be done in order to begin working as shelter as soon as possible. Readiness is probably the key. And price. Right now, the fund is already oversubscribed. There's 45 million in requests going before this committee with 30 million available in funding, again, to serve underserved populations in our county. So we are trying to conform with your request and with the request of the Oregon Community Foundation, showing readiness and seeking your approval to enter into a purchase and sale agreement which would just allow us to enter into a due diligence process, which the housing authority or the county does not have to pay for. OCF would cover that cost. Of course, if the property didn't pass inspection, environmental review, some phase of due diligence, we would get any funding back that we put down in order to, enter into the purchase and sale agreement. And we are just seeking your permission to take this next step with this property that was identified as a good fit.
Well, so I'm gonna go by order. I had my hand up first. I think it makes sense to move forward and with the due diligence portion and the purchase sale agreement and bring it back to a future board for final decision, because obviously you're gonna do an appraisal, environmental analysis, and other issues that may come up. And then the future board in January could make the final decision. So that's what I'd like to see happen, Ken. And then Paul, and then Martha.
Thank you, Mr. Chairman. Yeah, I think that that's probably the best way to move this. You and I will not have to live with the consequences of that decision, but either good or bad. The new board will have to live with that decision, as well as the community. And this gives additional time to do more outreach to the community groups while the due diligence portion of this is going on, which I think is a critical component. So I would support that approach. I think that's the way to go. You might have to put a term in the contract allowing for that. But yeah, I would support that.
Paul, and then Martha.
Yeah, I've got quite a bit to say on this, and I got some questions. So I just want to express my discomfort with how this came about, and the fact that I've spent so much time researching on the information that staff provided that got us here. So on November 17th, Rich and one of your staff members, Rich, made a presentation to us under issues about the turnkey project, and it was very clear, the staff member saying that this was for forest fire victims and relief, that they needed housing. I was all for that. We were all for that. That was the premise. In fact, my colleague, Mr. Humbertston, suggested that you reach out to the mayor of Estacada because he thought there might be a motel out there that's obviously in the center where the fires and the victims are, that it may be for sale. And I thought that was a great recommendation as well. So that was the premise, and it was the CARES Act dollars that were available and that had to be spent and had to be done before the end of the year. That's the premise. Okay, that's what we discussed. So that's November 17th. So apparently on November 25th, the conversation and the documents completely changed, and forest fires or forest fire victims were no longer the emphasis. The emphasis then shifted to a permanent shelter for people with chronic, basically, that experiencing homelessness within the urban growth boundary. And I can read the language. It's very clear. I'll just read one of them right here. It's designed, our application proposes to serve underserved populations of people experiencing homelessness in Clackamas County through this program. So it completely changed. And it seems to me that it would have been proper to bring this back to the Board of County Commissioners, who approved it on the premise that this was for forest fire victims. So my question is this: that's obviously not the focus. So what are we doing for the forest fire victims for housing? What is H3S doing? Because that was the direction, that was the purpose. So I'd like to know what we're doing for the forest fire victims who don't live in the urban growth boundary, by the way, who need services. So just if you could just help me out with that.
So that housing portion of that has been through the EOC fire response related to where there's a need for housing for the fire victims.
So what are we doing to help? What's H3S doing from the board direction to help the victims of the forest fires that are now houseless?
We can, this Econo Lodge would work for them. I mean, the contract that we just signed we'd be able to, house the houseless from the forest fires. They're not excluded from that. And I'm not aware of what the numbers are of the houseless from the forest fires that affected this county.
Okay, well, that's not how we just heard it here an hour or so ago in executive session. And I think the language and everything that's being cited here that been provided since seems really not have much emphasis on forest fire victims at all. That this is going to be a permanent shelter, not housing, but a permanent shelter. This is stuff out of your own. This is stuff you sent us. So appreciate your effort to answer that question, Rich.
Commissioner Savas, can I just say that we just completed the application based upon the grant language and requirements that were given to us by the state. They set those parameters for us.
Yeah, so I'm not sure, thank you, Jill. I'm not sure of the origin of turnkey. I understand what the program is, and it sounds like, frankly, it's got a lot of merit, that there's a lot of good aspects of that. So when I typed in Oregon and turnkey on the website, when I was doing my research, I came across under the CARES Act funding, and that there was $30 million for the counties with forests that were forest fire affected, for aid for housing for forest fire victims. And then there was another $30 or $35 million assigned under the CARES Act, okay, which has an expenditure date before the end of the year, for that amount for counties not associated with the forest fires, all under the premise of the CARES Act. The administrator this weekend replied to one of our constituents, and he again was under the same belief and understanding and replied that this was CARES Act dollars to be spent for forest fire victims, and this was what the effort was about. But we just learned an hour ago, an executive session, that it's not CARES Act dollars. I'm confused. The state says it is, and the gentleman earlier in our executive session says it's not. That these are state general fund dollars. So could someone straighten that out, because the state website says it's CARES Act funding?
Let me start, because I'm the one who sent the message to the community, because originally I thought this was CARES dollars, but the state emergency board changed that during a very contentious meeting about 2 months ago. This is my memory, if anyone wants to correct me, where they changed it to general funded dollars, and there was a disagreement whether it should be for anyone, wildfire-based housing, or all homeless housing. There's a huge debate with the emergency board. That is my memory, but can anyone correct me if I'm mistaken? Nancy, Jill, or Rich?
So Gary, you're correct that the first round of turnkey that went out which was also very debated and contentious, was for wildland fire. And it was for those 8 counties who had had wildland fire, and it was general fund dollars at that time. I don't know, quite frankly, I think CARES dollars probably was taken off the table because there simply isn't time. But the first round was for the 8 counties that had wildland fire. And I'm not sure, I didn't keep a turnkey the whole time, but I'm not sure how all of that may have morphed.
Okay, well, thank you for that explanation. That helps a little bit. My concern obviously was that the CARES Act funding that we did not get, comparable to our more populous neighbors, has really been a hindrance and has created a lot of difficulty for our constituents, businesses, employees, and patrons that didn't get their fair share of the funding. So that was, I'll just be honest with you all, that has been a rub that we've all recognized. Even Jim said it earlier this morning. We didn't get treated very fairly from the state when it came to CARES Act dollars. So I was a little bit incensed that that we would be circumventing the purpose of the CARES Act dollars to build permanent shelter housing, when in fact the businesses should have gotten their fair share of those dollars if those dollars were be basically redirected. And I know that that was an issue for a number of other folks in other counties and other businesses that were actually preparing or probably still prepared to take legal action for the counties that did not get their fair share of CARES Act funding. But that's not why we're here. That's a change. That's something I just learned an hour ago. So I want to shift to the other part of this. A year ago, over a year ago, this Econo Lodge prospect came forward to us, and came to us in executive session. And Rich, we talked about it earlier this morning, but basically you deemed and said, I'm paraphrasing, that the work you guys did, that it was not feasible to move forward with this project. And so essentially, here we are today. And Jill, I heard what you said, a week and 2 days ago. I'm looking at some of the documents and looking at the dates. It seems like at least at that point, whether it was a week and 2 days ago, that we could have done a little bit more outreach to the community, at least to us, at least to the Board of County Commissioners that had the impression that this was going to be for forest fire victims. And that's the green light you got. But what staff has expressed since then is that you were directed to do this in November 17th, and you were, but again, it was for forest fire. So if that changed, it seems like someone at least had an obligation to inform us of that change. Okay. Secondly, that there would have been at least some effort to do public outreach, that there would be some effort to have a more robust explanation and something in the packet for this session today. But this session today, there's no information. There's no highlighted, there's no packet, there's nothing. And it drew a lot of questions over the weekend. I didn't learn much of the things that I've already learned only an hour ago. So it feels like this is being rushed and rushed unnecessarily and without adequate explanation. So that has given me a little bit of consternation. I'll just be frank, because I think that you could have disclosed that to us. My staff yesterday reached out to your department and legal to get all the documents associated with this that were, frankly, I asked a year ago when this first came to us, and got no response. Not a yes, not a no, no response. So that didn't give me much comfort or opportunity to be prepared here this morning. And you indicated about an hour ago that we don't have a lot of that. We don't have a lot of the due diligence. We don't have the environmental assessment. We don't have the environmental review. We don't know if it's feasible or not. We don't know what the cost is to rehab these for permanent housing or permanent shelter housing. We don't know. And yet we are kind of, it seems to me, rushing this forward without really answering a lot of questions and actually doing some research. The other part about it that we agreed to coming out of that a year ago was the discussion about concentrating or not, and the rules of thumb and education from people that are in the line of work that we are all in, staff especially, for serving vulnerable populations, that what you don't do is concentrate poverty. You don't concentrate poverty, because if you put more people into areas of poverty, they have a higher ability to lift out and normalize and to be successful. There's stats on that. There's research on that. So that alarms me, because where this facility has some striking poverty numbers. The county in general is or the state in general is right around 13.2%. The county numbers are actually pretty low. Our county poverty rate is 8.3. It's the lowest in the state. However, there are cities that have, well, two of my colleagues live in Lake Oswego. I think it's like 3% poverty. West Lynn's 3%, something around, and so is Happy Valley. But other areas, Oregon City, Milwaukee, have higher poverty rates. The most common poverty rate along McLaughlin Boulevard is about 11.5%. But right here, it's 15%. The poverty rate for 5-year-old children is 100% of children age of 5 live in poverty. Now it's broken down in age groups. And it seems to me, let alone, I know this area pretty well. I had one of my business locations at this site. I know how problematic, how there are some social problems there, crime, so forth. The first time we were actually robbed at gunpoint was right there. I rented the building directly adjacent to this property. There have been a number of assaults, violence, and so forth in this area. And I just really don't think that is the wisest place for us to be putting vulnerable people, basically because of demographics. Well, you don't need to do a lot of research. This is all on the web. Our citizens have been pointing that out in the area for a long time, actually, about these demographics. So that's a problem number one. The other one is that about 2 years ago, and I appreciate this, it was great work. We had Martha, Commissioner Schrader, and I, and staff from multiple departments were working on the Veterans Village. And we were trying, before it even happened. And so we had a meeting every quarter. We were working together. We did great work. We had great communication. And the plan was to address shelters in Clackamas County for the need that is very evident today. It's a need. It breaks our hearts. I'm compassionate about this. I am passionate about this. It's important. But what we decided to do, and we spent money with the plan to locate the next site in an area that was more ideal for a situation like this. That had the ability for more capacity, that was not in a neighborhood with high density or poverty. And he actually identified and actually suggested a site, and that we actually built the Veterans Village with the intent of taking some of the assets and moving them to be mobile so we could capitalize on that. So that was the plan. Now, this team, staff, Gary Schmidt, the administrator, decided not to discuss it any longer, or not to meet any longer as this group. And that's unfortunate, because I wanted to follow through on the plan of how and where we most sophisticated, from a sophisticated standpoint, from an environmental standpoint, from the standpoint of access to services, all the things of doing it right, where we would site, and how we would site the next shelter in Clackamas County.
Paul, I got 3 other people waiting to comment on this. You're taking the whole discussion.
I am, and I mentioned that earlier, and the fact that it's under issues is wrong, and that's frankly, let me finish.
Well, how much longer are you going to take?
My point is this. I get it. You guys want to push this through. You want to sign an agreement contingent upon due diligence. You're not taking some basic things into consideration. Outreach to the community is not really happening. It's not going to be very effective in 30 days, right over Christmas and the holidays. This is terrible timing. And the fact that this is no longer CARES Act funding, and that there is no December 30th deadline, it doesn't seem to me that waiting 30 days until January 1 to kick this effort off and do some groundwork and then sign the agreements and do the due diligence would be a bad idea. But because we're not going to effectively be able to do public outreach. This is unfair. This community has asked for a park. Okay, less money than this acquisition. We were told they were basically voted down just getting the park. Why is this area seem to get the methadone clinic, seem to get all those, doesn't seem to get much love? And I think the poverty numbers and the fact that this is going downhill is a demonstration. Frankly, I don't think, that we are being very considerate, and that we could have found a better way to do this, and a better place to do this, and frankly, a lot less money.
All right, Martha, Sonia, Ken.
Hey, Jill, you mentioned another site. Where was it?
I don't have that at my fingertips, Martha, but I can certainly get it to you. I know it was in Canby. It met the parameters outlined, other than we don't have operations funding.
Because it's outside of Metro.
Yeah, so that's
Unfortunately.
that's one of the dilemmas we're dealing with, right? Is that the wraparound services, even though if somebody from Canby is working in the Metro boundary, they're paying the tax, but they can't utilize that for their wraparound services. So that's a limitation right there, because the only way you can get the wraparound services So that's, to me, it's a bit of an example of an urban-rural divide. But anyway, I'm not going to beat that dead horse. So the other piece of this is that as I'm trying to think this through, I do know that there are other models out there. I had pulled up information from NACO. And I believe it was, I pulled it up here, Newcastle County, Delaware actually did a project. They switched it from hotel vouchers and they acquired a Sheraton hotel. And basically they've been able to house people there. So I'm just, the only reason, and you can look that up and find that on the NACO website, and I'm just mentioning it, it doesn't actually necessarily apply to us totally, but it's a methodology that seems to be working in other counties. And then the other piece of it is that this was based on Project Room Key, am I correct?
Turnkey.
Turnkey.
Oh,
Well, no,
I don't-
but no, Room Key is in California.
Yes, you're correct.
Okay.
I'm sorry.
Okay, so in other words, it's a model that seems to be working in other places. And I do know that it got broad support from the Association of Oregon Counties. And I wanted to let my colleagues know I have Tracy looking up now all the emails and information I got from Greg Wolf and Andy from Housing and Human Services, so you can get a look at it. And I'll take responsibility. That was my bad. They were calling me at the last minute and I was just getting all this stuff. As far as, I have to make a comment about the urban rural piece of this, is that I believe that the emergency board, it was just a contentious conversation. It was all very political. And I think it was really the rural counties feeling as if they weren't going to get what they needed for wildfire relief. And that caused the rift between, I think, the politics of it right there. And that's why the counties initially that got it were the fire-related counties as well. And then, of course, they had an additional conversation and it went to everybody. So we qualify for both in a sense. But I do think it was really more politically based than anything else. So, I'm willing to look at this and go forward, but you know what? If you think this is a bad idea, I want to thank staff for their work and just don't do it. That's, and if we don't do it, well, I guess we'll have to figure something else out. I don't know what that is. I do think that there are people sleeping there homeless anyway. If we could give them a spot to stay, that wouldn't be a bad idea, but I guess that's the point, either do it or scrap it. So I'd like to hear from my other colleagues about what they think, because I don't even know what the next board's going to do with this. So anyway, thank you.
Chair
Hi.
Bernard, you're on mute.
Oh, Ken and then Sonia.
I'll defer to Commissioner Fisher first. I think she was ahead of me.
Oh, okay. I didn't see her hand go up until just now.
Thank you. So Commissioner Savas, Commissioner Schrader and I have definitely had an advantage of following this concept through from the very beginning, which was right at the time that COVID hit. And Jill and Rich and Vahid and the team have been really engaged with advising me in my role of the Association of Oregon Counties and Commissioner Schrader being on AOC. But I think this is a real huge opportunity for us because it's obvious that despite having a policy session on this issue and despite the continued conversations, not all of us have been kept in the loop. And so, Gary, I'm going to make a suggestion that as we move forward with the new board, that each commissioner's staff write up a report related to our liaison work to share with the entire board. I think that's very important, especially because Commissioner Savas raised some really good points that if he would have been more involved in the process, he would have known. Now, for me, I am very thankful that Commissioner Savas tackles transportation fully, wholeheartedly, and I trust that he's looking out for the constituents of Clackamas County. I defer to his leadership, and I so appreciate his detailed approach, especially when it's coming to the important issues of tolling. And when it comes to I-205 and Sunrise, it's like, I am right there with you, Paul, but we need to do better as a board. We can't be spending all this time. Our community is hurting right now. We had wildfires that put us into crisis. We have people sleeping on the, like as Commissioner Savas, he can go outside in his community right near this area and see people sleeping outside in tents. I say we must move forward, secure this purchase and sale agreement so we can do the due diligence and we can get people out of tents into these motel rooms based on this evidence-based program that's shown great success in other parts of the country and get people shelter.
All right, Ken, you lowered your hand?
No,
Oh, I don't see it.
I
Anyway.
lowered his hand on accident, but he is.
Oh,
up
you
next.
lowered his hand.
Yeah.
Okay, Ken.
it's Christina's fault. Well, the point of Commissioner Bernard's statement at the beginning of this conversation was to give staff the time to answer many of the questions and issues that Commissioner Savas has put forward, and still have a way out of doing this if it turns out that the answers to those questions are not satisfactory. So I would move to allow staff to go forward and establish a purchase agreement with all of the appropriate contingencies and inspections and whatnot like that, continue to do or really begin a more aggressive outreach to the community so that they have their say into this process, and that a final decision as to purchase be deferred until the new board is seated. And that is my motion.
And I'll second that. The final analysis will be, what's the problems? Is the price right? Is there a pollution issue, a water issue? Is the place going to take a whole bunch to remodel? Will be determined and brought to the commission to make the final decision. But I support that. Paul and then Sonia, and we go ahead.
Yeah, well, I just want to make sure that we're not rushing this, and even if it's a 2-week, I mean, you mentioned earlier in the earlier session that moving forward within 30 days, I just asking for a little bit more time to do that effectively, because Christmas, the holidays, is upon us. There's very few staff available. It's just a terrible time. I want to make sure there's adequate time for the outreach. Thank you, Ken. That's I appreciate your effort and emphasis on outreach that needs to be done. And and Commissioner Fisher's point, that's why we just passed the motion to get shelter. And the 27 rooms are already engaged. We just gave funding for that. This decision we're making here today does not change the immediate need between now and April 30th, because that's how good how long that agreement's for. So we are meeting the immediate need to some degree. But I'll tell you, the fact that Rich told us earlier, Jill, in an earlier session, that unit's already full. The people that, when I go walking every morning, okay, the people that are homeless out here, there's no place for them, no matter what we do. Okay, the kids, okay, that are sleeping in cars, the people that you don't see because you don't live where I live. I know Lake Oswego does not have this problem. I know where Ken lives and Jim lives does not have this problem. I see this problem. I am compassionate. I have been pushing this. I've been pushing this prior to any of you being on the commission, with the exception of Jim. When Commissioner Leininger was here, I made these pleas about the situation, about what we're about to do is going to make it worse. And it did make it worse. So my issue about not placing poverty where poverty already exists and putting people in areas where they can succeed has everything to do with their surroundings. This seems to go against the grain of all the people that have PhDs and spent their life in this work, that have that discipline. Okay, it's like the projects, you know, the areas around the country. What are all the mistakes they made? Segregation and concentrating poverty. Okay, we shouldn't be doing that. And that's a shame that it's so evident that this particular site has got those problems. And it just seems to me that we ought to be a lot smarter and wiser about it. So yes, I think we ought to look into it. And frankly, I don't want to limit it that, because there's other areas, as I mentioned earlier, there's other more ideally suited areas that have lower poverty rates. They're not concentrated in neighborhoods. They put less people at risk, and there's greater capacity. 27 units is something, but they're already used. They're already being used for this purpose. And we're not adding any capacity. We need more capacity. And we're spending a lot of time and energy on this with, it seems, more of a token effort than it is about really going and getting the capacity that we need.
All right.
So the people that I walk by, this is not going to help. The people that are around the corner, literally 200 feet away from here, 300 feet away from where I'm sitting, it does not help them. It's not going to help them.
All right, Sonia, and then Richard, and then Jill.
Yeah, I just want to make sure I didn't quite track Ken's motion, but we have a time frame situation here. We risk losing these dollars. I want to make sure that the motion that we're making is giving staff the ability to move forward with the purchase agreement so they can do the due diligence and that we do not delay this effort. In the meantime, of course, community outreach and looking further and doing all the things we need to do as a commission. I just want to make sure, Ken, that was your motion, because it was kind of wordy. If you could clarify that would be great.
That is the intent of the motion. But the critical component, to be candid, is that the final decision is not being made now by staff or in the future by staff. It will be made by the board.
Well, that's a part of how it works anyway, right?
That's correct.
Not as proposed currently. As proposed currently, they could move forward and make the decision themselves after today. We're modifying that so that
we have to approve the final sale. I mean, the final purchase of a property. That's what the commission does. Gary, could you weigh in and confirm that?
There are some agreements where you authorize staff to sign the final documents after they've done the legwork, which I see here in the staff report. So I do think you need to, what Commissioner Humbertston has suggested, in this case, you are formally directing staff to bring all findings back to the board for the board to make the final decision.
That's correct.
However, you're authorizing the staff to do a purchase sale agreement, and they can come back and say, well, that we don't find any issues with this property and the price is right, go ahead with it. I mean, that's the truth of the matter, is you purchase sale agreement. If it looks good, then you move forward.
Yeah, I just want to make sure that we are very mindful of the time constraints, that we risk losing this resource. We in Clackamas County talk about being on the short end of the stick when it comes to receiving resources. We can't leave these hard-fought resources on the table. Our county has really struggled through COVID, through wildfires, and we need all the resources we can get.
Call the question, Mr. Chairman.
Okay.
There's questions, there's hands up. Come on.
Yeah, but he called for the question. That ends the discussion.
That's unfair.
That's rule.
We've been discussing it for an hour, almost an hour and a half.
Commissioner Shaver has a hand up. Richard Swift has his hand up. I have my hand up. This is obviously a ram. This is, and the motion was changed.
Paul, I've heard you argue this very point. I've heard you argue this very point.
Commissioner Fisher changed the motion.
No, she didn't.
I didn't hear her change the motion.
It sounded like it muddied the intent and the dates and the time.
Paul, it clarified, because I want to make sure I was clear, and Ken Humbertston confirmed that I was clear, and Gary Schmidt clarified further.
I want to hear from my
To
colleague.
restate the
Commissioner Schrader.
motion?
I want to hear my colleague, Commissioner Schrader, speak.
Paul, you have argued this very point many times. It's been called for a vote. It ends discussion. So Christina, please call for a vote.
Fisher,
Aye.
Commissioner Humbertston,
Aye.
Commissioner Savis,
No.
Commissioner Schrader. Oh, you're on mute, Commissioner Schrader.
Martha,
I'm going to abstain because
Bernard?
this is too messy.
aye.
Go ahead and
Motion
change my
carried.
vote to abstain as well, please. I want to make my vote abstention on the lack of information, the lack of clarity, and the lack of even what the motion really is.
So can I be,
Including
can I
the
just,
timelines.
can I interject, guys, just for a second? Okay. I have had Tracy doing the research, and she is sending you all the emails that I'd gotten from Andy and Greg Wolf and all the other folks. So you will have that to look at, so you get some clarity as to what the genesis of this is. I don't know what else to say about it. You know, at the time, it seemed like a great idea, but it doesn't always work the way we want it to. So I'm just going to suggest you read those emails, and then if you have any questions of me from what I know, I'd be glad to do that. But if we're going to get a bunch of pushback from the community, and I don't know how feasible it is at this point. I supported the framework for Project Turnkey because I was working with AOC. So anyway, thanks.
Paul, your hands up.
It's down now.
Okay. All right, Gary, what's next? Thank you.
All right, so I'll just clarify, the motion that I heard is that staff is going forward with the purchase and sale agreement, which is contingent on appraisals and inspections and other due diligence work. And all that will be brought back to the board in January before anything is signed to finalize the sale. That is what staff, did you hear the same thing, staff? Want to confirm? That's what y'all heard. That's what will happen in January. Okay. Thank you. So next, Rich and Jill, Nancy, you can stay if you want, but you're welcome to go, Nancy. So Rich and Jill, stay, please. Next is Supportive Housing Services Loan Update. There was a policy session a few weeks ago about a potential loan from Wes. That is not happening, but we need to close the loop with the board. So Rich and Jill, please brief the board on what your final recommendation is.
Thank you, Gary. So in our previous conversations regarding getting ready for 26-210 and the arrival and injection of a large amount of funding into the county and building capacity for that, we had chatted with the board about the potential of the loan. We had approached the board about potentially a general fund loan. We had looked at maybe something from Wes. We know that we can't do anything with West because of state statute, and we also know there's incredible pressures on the county's general fund related to the fires and other expenses. And so what we did was looked at, essentially scraped the bottom of the barrel with an H3S to look at what could we do to fund the housing authority to get ready for 26-210. And so what we're looking at is actually two loans to the housing authority. I'll let Jill talk about those. It would be an intergovernmental agreement, and it would essentially, H3S would be loaning the housing authority dollars. It would be $400,000 of PLP dollars. It would be $300,000 from the Social Services Division and $400,000 from Community Family or Children, Families, and Community Connections. These dollars would be repaid in FY22. We believe that the repayment will be actually fairly quick, so that the repayment would be concluded in FY22 in terms of restoration of the funding back into H3S, actually for expenditure in FY22 by both SSD and CFCC. So essentially, this is a cash flow proposition for us to be able to build capacity 26-210 and not put any pressure on the general fund. So from there, I'll turn it over to Jill.
Just to clarify a few points that Rich made, the 400,000 from the Affordable Housing and Services Fund that the board committed through PLP a couple of years ago is not a loan. That's just being given to this effort to prepare us for supportive housing service funding. And the two IGAs from CFCC and social services, the IGAs have been written for a 2-year repayment term at the interest rate of 2%. And they would be effective July 1st. They would start July 1st of 2021. So it is a little bit longer repayment term for flexibility than what Rich just explained. I just want to be very clear. I just want to also let you know that we're deep in planning regarding supportive housing services. We intend to bring you a local implementation plan draft for your feedback, your comments, and eventually your approval in February. Commissioner Fisher is deeply involved in both our local committee and the regional committee work. So I'm hoping that she can bring you regular updates ongoing on behalf of all of this work that's happening. And then I wanted to make sure that you're aware that this upfront investment, much of it in the form of a loan, will ensure that we're ready July 1st to implement. Program implementation will be in place. And Metro has assured staff that with a conservative year 1 funding estimate of 24 million, they said that's very conservative. We've been asked to plan for additional 6 million for year 1. And that we've been told informally, because we don't have an IGA yet, to anticipate the ability to retain 5% for admin, which will, of course, allow us to repay that loan, that internal H3S loan. Are there any questions? Oh, one last point, I'm sorry. This is scheduled for a policy session to come before you on January 5th, and it will, the IGAs authorizing these loans will be coming before you for approval on January 7th.
Any questions? And what do you need from us today?
This was just, closing the loop because there are questions about what we're going to do in preparation for 26-210. And so this is informational purposes only to keep the board appraised of what we're trying to do to prepare for 26-210.
All right, that's what I thought. All right, I don't see any questions, so thank you very much. Your hand raised, Paul?
I'm trying here.
Okay, go ahead.
So it's not necessarily on this, but I just want to remind everyone that this morning, I politely asked you in their executive session that these topics would require more time, and I asked for more time. But when someone just calls for the question, that limits the time. So I think I have a lot to add, but obviously we have some artificial time limitation here. So that's unfortunate. So I'll have to carry this conversation on as best I can. But I do want to say that under the December 17th board packet that introduces the item that we just talked about, Project Turnkey, it cites in there how in the block there of outcomes and everything else. Well, obviously some of that information is incorrect, but I would like under strategic plan alignment, I'd like to know how it aligns with all of our strategic, at least our goals, because what's missing there, how does this align with economic development? How does this align with, and frankly, health and safety, ensuring safe and healthy communities in this particular area? That's got to be an oversight. Citing the earlier demographics. And is this a recommendation from the Economic Development Commission? How does this work when it comes to restoring or maintaining trust with our community under the circumstances where the rationale for moving this forward is completely different than it was 2 weeks ago? The lack of information, the lack of ability to discuss this, the fact this is not a work session when this was approved as a work session on November 17th. We had a work session. This is not even a work session. There were no materials in today's packet. I think that's just blatantly wrong. That does not build trust with the community. So that ought to be put on there, frankly, and amended what it didn't meet in the strategic plan alignment.
All right, great. Any other questions on this issue? All right, Gary, what's up next? Thank you, Richard,
Thank
Jill.
you.
Thank
All
you,
right,
Brother
have a good
Rick.
day.
All right, next, legal representation policy. Stephen Madcourt, County Counsel, bringing this back to you. There was a memo in your packet. Stephen, please go ahead.
Yes, good morning, Commissioners. Thank you, Gary. Commissioners, this is a revisit of a March 10th, 2020 discussion that we had with the board. We being myself and Risk Manager Eric Machado. At the conclusion of that session, a policy session, it was generally expressed approval for the new legal representation policy with some additional language proposed by Commissioner Humbertston and Commissioner Savis, as well as Commissioner Fisher. That language has been incorporated into the version that I circulated last week. It's highlighted in yellow. I apologize for the delay in the revisit of this, but it was really a consequence of the COVID, but we have resurrected it. And I would like to get the board's formal approval on this. It improves the existing legal representation policy. It allows the board greater latitude. It still vests entirely in the board the decision to and under what circumstances and what amount to pay for outside legal counsel. But I think it provides for a better avenue than what we currently have. And the version that, like I said, I circulated to you last week was the same version I circulated to you after the session on March 10th. And I have heard no comments or criticisms about that version, but I am here to answer any questions that the board would have. And if you were to agree with the content of the policy today, we would formally incorporate it into official county policies moving forward.
Okay, I got Sonia and Paul.
So Stephen, I don't see the yellow highlights. I was trying to struggle through this, compare them. I can't see what the changes are. I've checked the memo that you sent us and I checked the one online. I'm just wondering if we can just hunt this just for a little bit so I can have some time with an interlineated or the highlighted version. If that would be okay.
All right, could you do that during lunch?
Sure, happy to.
Okay. How about if we just bring it back, Stephen, after lunch?
I will be ready.
Okay, let's see if Paul wants to ask.
Well,
And I just think that the format in the PDF just needs to be of a higher quality when it gets converted so we can see your highlights.
It was clear as a bell. It was clear as a bell to me. I don't know why. I saw it in the email. It's clean and clear. Mr. Madcourt, you can just post it right now and get this done.
So Paul, you saw the yellow highlighted?
Yep.
So I've checked on 3 different devices. I
So
can't
let's
see
bring
it.
it up. Can we share it on the screen?
Oh, you guys, I want some more time with it if possible. If we
Oh.
could bring it up after lunch and I'll figure it out. If that would be okay.
I'll make sure Commissioner Fisher gets a copy with the highlights and also the strikeouts and the underlines. I can do that. I have no problem with revisiting this afternoon.
Okay, good. Are we okay with that, Gary?
I got one proviso. I'm trying to get into the doctor as fast as I can. I hurt my back over the weekend and anyhow, I need to go back again for an adjustment on the medication. So I'm hoping we can do this right after lunch because it looks like that appointment might be a little bit later. So please do this right away after lunch.
We'll do it right at 1:30 before your first policy session.
Thank you.
All right, great.
Were there any other comments on this?
Oh, I'm
I was
good
ready.
to move
I thought
forward.
it was great.
Good. I'll work with Commissioner Fisher. We'll get this back to you before 1:30.
All right, great.
Thank you.
Okay, next, courthouse state bonding update. Gary Barth, our project manager, will come into the room for this. I sent you an email about it, commissioners. We had a deadline changed on us by the state of Oregon, so this is a decision you have to make today, which was in the email I sent you, but Gary will give a quick high-level overview and then have a conversation. So Gary Barth, please unmute yourself.
To bring up my video.
There you are, Gary. Go ahead.
Good morning. Courthouse funding. Is a quick overview. The board recalls when we submitted the OCCCIF application to the state, we had a high-level cost estimate that had been prepared by Sarah Architects under a scope of work to complete that submission. That high-level cost estimate included a courthouse project projected at $189 million, and the state agreed to pay for half, $94.5 million. They requested that we split our request between the two bienniums and only request the amount that you think you might incur during that biennium. So we made a simple split and requested 1/3 in the 1921 biennium of $31.5 million, and anticipated asking for $63 million this spring for the 21-23 biennium. And that would get us the 94.5 match. That is a ceiling. That was based on a very high level cost estimate. As this board knows, we're now into the analysis of the next phase of the project, which is including value engineering, working the cost, and also working with the finance department on the affordability target. So there's a chance that most likely that we will request less than $94.5 million from the state, but that is our earmark right now pending further analysis. We were advised, we were told that when we requested the 19 to 21 allocation, the bonds would be issued in the spring of the second biennium, second year of the biennium, which would be spring of 2021. We were advised a couple of weeks ago that bond issue is actually scheduled for February 24th. And we were advised that they need a spending plan by December 14th, which was yesterday, of how we would spend, request the reimbursement of $31.5 million, meaning we would have to spend $63 million to get $31.5 million back. And that $63 million would have to be spent in the 3 years from the date of bond issuance. So we'd have the period of February 2021 through February of 2024 to spend the first $63 million on the project to get reimbursed for $31.5 million. Long story short, because of all the delays we've had in this project and the timing, we don't have a spending plan yet. And we don't even have board approval to proceed on this project because you are waiting for us to come back with all the final analysis that you need. So our recommendation, because of these timelines, is that the state not issue any courthouse capital bonds in February, and that we make our full request for 100% of the money. Instead of splitting it 1/3, 2/3, we put our request for 100% of the match funding in the next biennium that will be developed this spring. So it'll still be $94.5 million, subject to us lowering that perhaps, but instead of being 31.5 and 63, it'll just be all 94. So the numbers don't change, the timing is the only thing that changes so we can comply with the state's bond requirements. This is not unlike what Lane County asked for 100% of their money, even though they were given the same instructions we were. And so Lane County, as you know, has been delayed, but as far as I know, they're going to be resubmitting for 100% of their funding again in the next biennium. So the risk, there is no concerns on how this will affect our project. The risk is the state doesn't roll over. So that $31.5 billion doesn't just roll over and get added to our 63 request. We have to go in and ask for a new request of $94.5 million up from 63. So that's the risk we face, is that the upcoming legislature won't approve the 100% match of 94.5 million, that they'll only approve the 63 million, 2/3 that we already have in the governor's budget. But I don't see any other option, because if we were to make up some kind of spending plan and then have them issue bonds on February 24th, we have just committed the county to spending $63 million of county money and getting reimbursed for 31.5. And I don't believe we have board action or approval to make that commitment at this time.
I did see some gold flakes in that creek over here. I'll start panning today. Paul.
So Gary, if I heard you right, and I don't necessarily disagree with what you're suggesting here, but that we would have had to not just spend $64 million between now and in February or whatever it was. Was it February?
February of 21 to February 24, that 3-year period.
Right. So we don't have $63 million to spend between, even under that timeline. And my question is, if you up it to 93 million, where are we going to get $93 million to spend within that time, those new timeframes?
Well, the original OCCIF application assumed that the county would issue bonds and borrow money and get the project done. And then once, with evidence of us having that funding, then the state reimburses us for 50%. So we always kind of had that challenge of coming up with the money first and then getting 50 cents on the dollar back from the state. So we would have had to take out some, bond anticipation notes or a line of credit or something to manage the cash flows in this. So we still have to come up with half of the project cost that is our permanent responsibility. But as you know, one of the reasons we were proposing this P3 alternative delivery process is that the private entity will come up with all the funding to design and build the new courthouse. And we won't have a payment due until the building is complete, at which time we could ask the state for their match and make a down payment of that private debt. And then we would pay our half over time in the lease payment. And we're working with the state because we'll have to make sure that complies with their the OCCIF program, but they've been with us lockstep. They know exactly what we're contemplating and proposing, and they've actually been very encouraging, thinking that if this is an approach that works for Clackamas, this may be a new model for them going forward. But that was one of the reasons we wanted to come back to you in the spring with this P3 delivery approach. Is it would allow us to move this project forward with your approval, with an affordability target and a financing plan, but not having to come up with any cash until the 24-25 timeframe. And then we would make the down payment from the state at that time. So there'd be no reimbursement and us spending money and getting 50% back. We'd basically you'd be a ribbon cutting, and you'd ribbon cut for the new building and get the big ceremonial check from the state for half of it, and pay down that debt. So that's kind of why we were pursuing this approach. But the timeline is for us to have all that information in time for this legislative session, but we certainly didn't have it in time for yesterday's deadline of a spending plan, because we're just not there.
Yeah, so if I understand your request, is really to go back and seek a change with the state to make those accommodations. And I move, if you need approval, I'll make the motion.
Second.
Any further discussion? All right, Christina, please poll us.
Commissioner Fisher has her.
Oh, Commissioner Fisher.
Gary, I read your memo. I've tried to make sure I got my head around this. I just want to make sure I have this correct. So I'm going to summarize what I think it is so I can vote yes on this. I apologize. I'm trying to track it. So basically, because we're going with a P3, we are not in a position to spend resources. And so it doesn't make sense for us to get that money now. And because of that, we are in the process of getting a different type of approval with the state. Is that part correct?
Correct.
And our risk, well, obviously we don't have any choice. We decided to go with a P3, so we can't just go spend money. But our risk with this, which is always the risk, which is a risk that we've known about since we began this effort, is that the legislature could at any moment change its mind. Is that correct?
Correct.
Okay, I just want to make sure I got
We
it.
had no certainty of the 63 million until this legislature meets in the spring. It's
Right.
earmarked, but it's not guaranteed until the board. So
Okay, with that clarification, I am an aye. Thank you so much.
We'll move on to Commissioner Humbertston,
Aye.
Commissioner Savas,
Aye.
Commissioner Schrader,
Aye.
and Chair Bernard.
Aye, motion carries unanimously. Thank you. Good to
Thank
see
you
you,
very
Gary.
Gary Barth,
Nice
would you
seeing you
please,
all.
Gary Barth, would you please email our courthouse leadership team, the judges, DA, sheriff, so they're all aware of this, please?
I will.
Thank you.
Thank
Okay, we're almost done, commissioners. Next, advisory boards and commission appointments. Christina.
All right, today there are 3 advisory board and commission appointments. The first one is the Enhanced Law Enforcement Advisory Board, staffed by the Clackamas County Sheriff's Office. They currently have 6 openings. 7 applications or resumes were received, and 6 were recommended to be appointed. James Rhodes would be his first term, Thomas Andrusco, first term, Antonio Cabine, first term, Gavin Carpenter, second term, Eric Hendricks, third term, Michael Wilson, fourth term. The second is the Committee for Community Involvement, staffed by Public and Government Affairs, and they currently have 4 openings. 1 application was received and 1 was recommended to be appointed. Britt Perry's, it would be first term. The third is the Community Road Advisory Committee, staffed by the Department of Transportation and Development. They currently have 6 openings. 4 applications were received and 4 are recommended for appointment. Susan Sue M. Hine, first term. Daniel Lohman, first term. Nathan McCarthy, second term. Patricia Tani, second term.
Move to approve.
Second.
It's been moved and second to approve the slate as read. Any further discussion? Christina, please poll us.
Commissioner Fisher,
Aye.
Commissioner Humbertston,
Aye.
Commissioner Schrader, or Savas, excuse me.
Okay.
Aye.
Sorry. Now Commissioner Schrader
Aye.
and Chair Bernard.
Aye, motion carries unanimously. Thank you, Gary.
All right, next I'm jumping ahead because we've had staff waiting. Preschool Early Learning Hubs update. This was a request from Commissioner Fisher. We have staff from Health, Housing, and Human Services, Danny Stam Thomas, who's been very patiently waiting, and Roger Cook and Rich Swift. We have a lot of staff there, so I'm not sure who's covering this, but please go ahead. You have 5 minutes. Oh. Danny, I think Danny's the lead, so Danny, please go ahead.
Sorry about that. I'm going to allow Rodney to take over on this. He can introduce Danny, and because I know you guys are time constrained, and do a brief update on the preschool. Thanks.
Yes, good morning, commissioners. I'd like to introduce to you Danny Danielle. She's new to the county. She's the Early Learning Hub coordinator, and we'll be working closely on these issues. So we brought her forward because she's our resident expert. Danny?
Thank you, Rod, and good morning, commissioners and chair. As stated, I am Danny Stam Thomas. I'm a senior program planner with Children, Family, and Community Connections, and I am currently serving as the Early Learning Hub Director. My fellow senior program planner, Chelsea Hamilton, and I work toward alignment of systems serving parents and children birth to 8 years old. And I'm here today to present on the work we are doing in the Early Learning Hub and include a quick update on preschool and childcare during the pandemic. We prepared a brief document for the board on the state of childcare in our county that I hope is illuminating in addition to the information I'm sharing today. I believe you have received that. So overall, current data shows that childcare programs and publicly funded preschool in our county are experiencing an unprecedented amount of program vacancy. The under-enrollment of preschool and childcare programs in Clackamas County is not unique to our region. Statewide, we see similar trends of vacancies. Feedback from our local programs suggests various enrollment challenges, such as parents' concerns over safety and having their young children exposed to the virus in group settings. This comes as childcare providers, many of whom are small businesses, are struggling to stay open through the pandemic. This is due to increased costs of supplies, such as PPE, and greatly decreased income due to the under-enrollment. These factors have already pushed 31 licensed programs in Clackamas County to close since March. This loss has primarily been in our smallest home-based businesses and represents a permanent capacity loss of 7% as of yesterday. This year, the role of the Early Learning Hub has also changed somewhat. We are still responsible for coordinating system change, and we provide some direct services, but we are no longer managing preschool services directly. Instead, we have been tasked with enrolling families into Preschool Promise. Preschool Promise is the state-funded program that serves children 3 or 4 years old whose families are living at or below 200% of the federal poverty limit in full day preschool programs. This year, it was expanded from having the capacity to serve 28 Clackamas County children to serving over 170 children throughout the county. 8 programs in our county were awarded funding to provide these services. Currently, there are 55 children enrolled in Preschool Promise and 118 vacancies, which leaves us at about 68% vacant. In addition to Preschool Promise, there are 3 agencies in Clackamas County that operate federal and state funded Head Start programs to serve children 3 or 4 years old and their families who are living at or below 100% of the federal poverty limit. Currently, there are 609 children enrolled in our county's Head Start programs, with a total of 199 vacancies, which is 33% vacant. There are distance and in-person options available within Preschool Promise and Head Start programs, but we know that parents still have safety concerns in sending their kids to early learning and childcare programs amidst the pandemic. We are looking at various ways to reassure parents of the safety precautions that programs are taking to keep children safe. We plan very soon to film video tours of programs that are offering preschool so we can provide some comfort and knowledge to those families. Near the end of December, we are also going to launch an outreach campaign to survey Clackamas County parents to make sure we fully understand their reservations in utilizing childcare and preschool services. Our Early Learning Hub funds the work of 6 bilingual, bicultural family resource coordinators, or FRCs. These individuals help families navigate the very complex social service systems and assist them in overcoming barriers to access. They routinely connect families with young children to food boxes, clothing and diapers, medical services, rent and energy assistance, legal services, and parenting education programs. We have found that currently our FRCs have a wait list of families waiting for service. This program is a key resource in our community, which we know families are accessing now more than they ever have, and our hub is looking at ways to enhance this program. Our last update is that our hub contract with the Early Learning Division will be up for renewal at the end of this fiscal year. We are told that the RFA for that will come out in February. So at that point, we'll begin working on the non-competitive RFA process for this grant for another biennium. I appreciate your time and for having me today. Thank you.
Rod, do you want to add anything or?
No, just that I believe that I took the survey myself that the county put out for childcare needs for employees. So I think the work of the Early Learning Hub, if we continue to link that work with what's happening in our real life in real time, it's a great opportunity. So I think we're just here at the disposal of the board to help you through anything you might need as it relates to these childcare needs.
All right, so Martha and Sonia. Mike.
I've been beating the childcare drum for a while, as you know, but now what I'm hearing from the business community is a lack of childcare. But what you're saying is, but you're giving me a different narrative that the childcare, there are spaces that aren't being filled. Is that correct? I'm trying to figure out where that disconnect is. I mean, because you just said, am I right? I mean,
Yes, that's correct.
yeah, but so what's your connection with the business community and workforce in terms of finding out why we're hearing two different things?
So we are very always working on getting more businesses connected with information about early learning. We have a really close partnership with the Clackamas Workforce Partnership, who works with businesses in workforce issues, and they've taken on childcare as a particular issue that's
Right.
important to businesses as well, as you know. I think we've, for years, had issues of not having enough childcare. And the issues still remain, especially in extended hour care and, you know, more than shift work, overnight care, evening care. Those are all still very, very rare. We have one program, I believe, in the entire county that's open sort of outside of regular business hours, who does evening, weekend, and there's one program that does 24-hour care. So there's not a lot of flexibility in the current market for anybody who needs those things. We know that our frontline essential workers who work at hospitals work much longer than most childcare programs are open. So all of those families are having immense amount of difficulty finding a program. And so the disconnect is that they don't fit together necessarily. And then we also know that we have parents who need childcare for their children and have gone to find a spot. We've even have families in Preschool Promise who've called and gone all the way through the process. And right as they were supposed to start attending, some of the fear crept in and they decided to stay home instead. So we are really trying to look more into where the families are coming from and the choices that they're making and what services need to be offered to connect those more closely together.
Okay. So I have a question with your connection to education, because when I look at the state requirements, you're supposed to be having metrics for kindergarten readiness and third grade reading readiness. How do you track that? Because it sounds as if you're contracting out to various providers, but how are you describing yourself as a hub, I guess? A hub to me is what happens in Gladstone. Okay, so how are you operating as a hub, and what are some of those other metrics? Are you able to get them? Are you able to work with the educators? Could you tell me a little bit about that?
Yes, so all of the programs that we subcontract to provide direct service to families report to us quarterly on the amount of families they've reached, on the outreach efforts they've done, and all sorts of different metrics around equity and the languages of the people they've served, the race and ethnicity backgrounds, and the difficulties that they're having in serving certain populations of families. So that's one way. Now, as far as how we define ourselves as an early learning hub, we are working to get a much clearer picture of the early learning division's vision for early learning hubs moving forward. We are guided by a governance council of early learning partners from across the county and the metro area who guide the work and help us to know how to implement it with what resources and direction the early learning division gives us. So unfortunately, that has been a little bit in flux this year, and we expect to see that defined much more clearly in the next RFA process as to what the early learning division envisions for a hub moving forward. But we do envision ourselves as a hub, as the people who bring all of the early learning folks together to solve these systems issues.
So it's systems issues, it's not just divvying out money.
That's correct.
There's some of the players around like the community of care tends to be a group that divvies out, they get together, it's all internal. There doesn't seem to be much of and I'm afraid that I almost perceive this as being somewhat similar, I guess. And you didn't answer my question about reading and kindergarten readiness.
Yes, so on our board, We
You actually-
also,
Yeah.
yeah, we get the data from all of our local school districts as they are doing kindergarten assessment on incoming. We have many school district partners on our early learning council, and the Gladstone folks sit on the council as well and come to our meetings to inform the decisions about where resources need to go. Last year, we embarked on a pretty hefty lift of ECE sector planning to figure out what those kindergarten assessment scores were telling us, what the readiness and the reading levels were telling us about where children need services, what specific areas, and we were able to drill down specifically into our county where services are missing and what those children are needing in order to be successful. So we do have an immense amount of data around those things.
Sure. Would you be willing to just get me some of that? That would be really helpful. Thank you. Thank you. Thank you so much.
Absolutely.
Okay.
Tanya.
Yeah, so my interest in having this brought up, I mean, this is great. This is way more information. It's wonderful to engage on. I know we're short on time, but my real question was, we are expanding preschool. We're in the middle of a pandemic. What are the protocols, and how are we doing this? How are kids going to preschool was my question. Because kids in, unless they have special needs or there's special circumstances, aren't attending in-person instruction.
So there's been a few iterations of that since March based on what the Early Learning Division and the Office of Child Care have decided is safe, and also balancing that with what is needed for families who are working outside of the home still and those essential workers. So at the very beginning, it was a very pared down, the ratios were really tight. What we have now is stable groups. So they've allowed the ratios to go up a little bit, but in each kind of center license, there are requirements for the size of group, and that group has to be stable. So they can only serve the same group of children day to day. That can't change throughout the week. And the staffing also has to be stable, which has been difficult for some of the programs to implement, but we know that it also is keeping people safe. So the same staff people, the same children in the same classroom who do not move from place to place during the day. There's also been a lot more implementation of sanitizing. Groups of children are not supposed to use the same toys. When they transition from this group who's playing with them to the next group, they have to actually be taken out and sanitized first and cleaned before they can be brought back into the play space. Shared things like we would normally be doing watery tables or sensory tables, those sort of things are not allowed right now. They've had to be taken out of classrooms and not used by children to make sure they're not sharing those germs, and they're only allowed to play in their play groups. So on the playground, they can only be in that group. In the classroom at lunchtime, they have to do social distancing during lunchtime. Children over 5 are supposed to wear masks during the day, and so do all the adults who are in the classroom. And because they take their masks off for meal times, they're socially distanced. So they're supposed to be 6 feet apart when they're eating or doing.
So in summary, preschool is going on with lots of protocols, unlike in our school system. So that was basically the gist of my overall question. I'm just trying to get my hand around what's going on for younger children, what's going on for older children, what the public policy is, what our role is, how we're implementing it. And, interesting. So I really regret that I have not been able to go to an early learning hub meeting there at the same time that we have our Tuesday policy sessions. And I've tried to skip out on these meetings to go there, but it's just not possible. If there's ever any opportunity to be engaged with that group, I would really love to do that. I used to staff the Early Childhood Care and Education Council in Malona County many years ago, and been really involved in policy on those issues 20 years ago, super engaged. And it's crazy because the issues are still the same 20 years later, which is a little bit frustrating. But there you go. Thank you so much, Danny. Really so nice to meet you.
You as well. Thank you, Commissioner.
And what do we need? What do you guys need from us today?
We
We
would just
will-
be at your request to give an update. a brief-
Okay, it's just an update. All right, I don't see any other questions. Thank you for the update. Sounds like great work.
All right, thank you all. So commissioners, I have two quick updates and then commissioner communications. Do you want to finish this now or come back at 1:30 and do this right before the first policy session?
1:30.
Come back.
Okay,
1:30.
so we'll finish
I'm
it at
hungry.
1:30. Okay, that's all for now then.
All right, thank you.